Hello students, this is Seema Singh, your SSC teacher. I will start chapter 4 in civics, role of the government in health. We have studied briefly about the role of government in the previous class. You learned that it is the duty of the government to work towards the welfare of the people and provide them security, health, education as such facilities that they can live in a fearless, happy environment. In this chapter, we shall learn about the role of the government in health. Health and environment. People generally remain healthy if they live in an area with clean air to breathe, pure water to drink, safe, uncontaminated food, and a workplace where they are safe from accident and injuries. Actions by the government for a healthy environment. The government has agencies like the municipalities which are responsible to ensure that the conditions for healthy living are maintained. They are responsible to ensure provision of the safe, filtered or treated water by taps or tankers. Maintain cleanliness of areas by employing people specially for this purpose, ensuring drainage and sewerage system so that the living environment remains healthy. Health and medical aid. Medical aid is required for two aspects of life: prevention of disease by way of inoculation, vaccination, etc. The second aspect is treatment once the disease has occurred. This includes doctors, dispensaries, laboratories, and hospitals. Let us take these one by one. Prevention diseases. Changes of spread of many diseases would automatically reduce by ensuring that hygienic conditions are maintained. The waterborne diseases like diarrhea, cholera, jaundice can be reduced by use of safe and pure drinking water. There are some mosquito-borne diseases like malaria, dengue, etc., which are spread by particular mosquitoes. Campaigns are launched to educate people to ensure that there are no stagnant water close to houses, in ponds, puddles, and unused coolers, thereby preventing the spread of diseases. Treatment of diseases and injuries. Despite all preventive actions, there would be diseases and there would be injuries. They are part of life and one can only try to be safe. It can happen anywhere and anytime. Public health care. The treatment facilities are created by the government at various levels and are clumped under the public health care. They are called public as they are made by the government from money collected from the public in the form of taxes and for welfare of all the people. Private health care. Many private hospitals have come up in the country. You can see clinics at nearly every nook and corner of the markets in the cities and towns, with huge posters claiming treatment facilities. There are many nursing homes, trauma centers, etc., which have come up in the urban and semi-urban areas. This system of medical care comes in as a private enterprise and is mushrooming because the increased population had increasing requirement, which was not being adequately met by the public healthcare system. There is an urgent need for increasing the ability of doctors and trained staff in the rural areas, both by the government and the private sector, but these places are not much profitable and therefore not attractive enough for the private sector. The nation will progress only if the people of country are healthy.